Alexander Jordan. I'm an ICU nurse and my presentation covers the topic of nursing alarm fatigue. A brief description of nursing alarm fatigue starts with the issue, alarms. Constant monitoring of patient vitals is a requirement for most ICU patients. With this constant monitoring, technology inevitably fails, which leads to an increased number of alarms and creates a scenario called cry wolf. In this situation, too many alarms sound and cause nurses to become conditioned to not having true patient emergencies based on the alarms that sound. This is a real issue because in a true patient scenario, care is delayed, meaning that life-saving measures might take too long to be implemented. The research behind this issue proves the reality of the situation. Over 100 alarms sound every day, and within those alarms, up to 99% were not true to their signal. These statistics were collected on multiple ICUs across the United States. Reaction time to these alarms showed to be somewhere between 5 and 10 minutes from start of the alarm to the solution. Management of these alarms is meant to be urgent, and if handled properly, can show a decrease in environmental stress. The goal of this QI project is by September 1st, 2026, nursing staff will see an improvement in mental health and reaction time to patient issues as their alarm fatigue improves, with a decrease of non-actionable alarms by 15% within Baxter Hospital. Strategies to achieve my aim involve implementing personalized alarms to fit patient needs, frequently changing electrodes on patients, and constantly monitoring daily for the need of monitoring. These changes require the nursing staff, including charge nurses and staff nurses. Resources for these two groups include training, supplies, and approval from the unit director, as well as the clinical informatics team. The new alarm bundle will require 3 weeks to complete. During week 1 and part of week 2, a pre-intervention survey will be implemented to the nursing staff to gauge baseline alarm fatigue levels. An audit of alarm count, as well as one for electrode changing practices, would also occur during the first 2 weeks. During the rest of the second week, the unit huddles will be done to educate staff on thresholds and skin prep of electrodes. Electrode checklists would also be going live during the second week. During week 3, both charge nurses and QI leads are responsible for checking electrode changing and ensuring that alarms are personalized. Needs assessment will be completed during this week to verify patient needs and monitoring. This slide breaks down the timeline into a visual involving daily goals. Data collection should include total daily alarm counts and the delay of nursing response to alarm. Interviews of nursing staff that identify levels of alarm fatigue and perception of stress are also needed to be collected. Analysis of this data will show useful if there is a 50% decrease in non-emergent patient alarms. Staff satisfaction should also see an increase. Audits of electrode changes and needs assessment for constant vitals should also be collected. Data collection during the QI would be compared to a baseline data prior to the initiation of the QI project. How I address challenges depends on what is being presented. Staffing assistant would be met with education, and electrodes would need replacement if there is an excessive ECG alarms. The initial results of the project would be improved through the adapt, adopt, and abandon method. This means that based on the performance of the QI project, I will either change parameters to adapt, leave the project as it is, and adopt it, or through a series of failures, completely abandon the project. Outcomes have already been specified in light of success as reduction of 15% of non-emergent alarms. This reduction will be considered a success if there is an improvement to nursing satisfaction as well as a reduction in nursing reaction time to correcting alarms. These successes will be accomplished through personalized alarms, frequent electrode changes, and daily needs assessment. Maintenance of the improvements often can prove difficult based on stakeholder investment. Education is the best medicine for non-compliant nurses. Super users that spearhead the QI project and now act as a model for other nurses also help staff retain the usefulness of the project. Policy changes that include the alarm bundle for all patients is another way to maintain the alarm bundle after the project is concluded. Key takeaways of my QI project is that the field of nursing is responsible for the health of their population, and to complete their job they rely on technology like electronic monitoring to take vitals and track patient status. Constant monitoring has its negative effects, which include alarm fatigue. This issue leads to other issues that can be as serious as patient death. This quality improvement project aims at alleviating some of the alarms that could cause fatigue and decrease the amount of time for nurses to respond to patient alarms. This process involves a 21-day time period to see how a new alarm bundle will affect the desired issue. Patient care will improve based on a successful QI project based on the reduction of the crying wolf phenomenon, which is a leading cause of alarm fatigue. Here are my references. Thank you for watching.